Now we will study what is meant by power of accommodation. Power of accommodation means the capacity of an eye lens to adjust its focal length as per need. That is known as power of accommodation. So once again, what is meant by power of accommodation? The capacity of an eye lens to adjust its focal length as per its need. That is known as power of accommodation. We can say that in case of faraway object, or if a person wants to see a faraway object, so its eye lens flattens. In case of nearby object want to see, that particular time eye lens gets rounded. As a result of it, if the eye lens getting rounded, we can say focal length of the eye lens decreases. If the eye lens flattens, then we can say that focal length of the eye lens increases. As a result of it, once focal length increases, faraway object can be able to seen by the person properly. If nearby object is there, at the same time focal length of the eye lens decreases. As a result of it, nearby object can be able to see properly. So we can say that what is meant by power of accommodation? The capacity of an eye lens to adjust its focal length as per need is known as power of accommodation. Next one, what is meant by minimum distance of distinct vision? What is meant by minimum distance of distinct vision? From the eye. So we can say that the minimum distance from the eye of an object to which a normal eye can see the object clearly, then it without any strain or stress, then we can say that minimum distance of distinct vision. So what is meant by minimum distance of distinct vision? The minimum distance of an object from a normal eye without any strain. So that means minimum distance. Now I am saying you for seeing the object very clearly. So from the eye towards this object, minimum distance should be at least 25 centimeter. Then at that distance, we can be able to see the object very clearly without taking any strain or stress. Then we can say that this is known as minimum distance of the distinct vision. Distinct vision means a clear vision. So what is meant by minimum distance of distinct vision? The minimum distance of an object from the eye to which it can be able to see very clearly without any strain, then it is known as minimum distance of distinct vision. Next one, what is meant by farthest distance of distinct vision? Now we have to see that the farthest distance from the eye. We can say once again, the farthest distance of an object from the normal eye to which it can be able to see very clearly without any strain or stress, then it is known as farthest point of distinct vision. So once again, what is meant by farthest point of distinct vision? Farthest distance of an object from a normal eye to which it can be able to see the object very clearly without any strain to the eye, then it is known as farthest distance of distinct vision. Now we will study defects of human eye. There are three different types of defects of human eye. The first one, that is known as myopia, or we can call it as near-sightedness. Myopia or near-sightedness, its meaning nearby things can see, far away things cannot to see. Other one, that is known as hypermetropia. Or we can say as far-sightedness. Now, one more is there, that is known as presbyopia. Then the first one, that is known as nearsightedness, or we can say as myopia. Second one, farsightedness, or we can say as hypermetropia. Third thing, that is known as presbyopia. Now presbyopia is getting to the old people. Now first we will study these two, afterwards we will study the presbyopia. Now in case of myopia, first I am drawing the normal eye vision. Here eye lens will be there. Rays of light is coming towards the eye lens. After that it converges at the retina. So rays of light which is coming from nearby as well as far away object coming and passing through the eye lens, and later it converges at the retina. The person can see the object very clearly. Here also I am drawing the same figure. These three figures I am going to explain about the hypermetropia. So here I am explaining about the normal eye vision. Same way figure I am making. Now the rays going and converging at the retina of the normal eye vision is there. Such people can be able to see the nearby as well as far away objects clearly. In case of myopia, nearby things can see clearly. In case of hypermetropia, far away things can see clearly. In case of myopia, far away things cannot see clearly. In case of hypermetropia, nearby things cannot see clearly. Now for myopic patients, which problem they are facing, we'll see. Here again I made their eye lens is this. Now here the ray which is passing through the center of the lens. Now in this case the ray which is going and hitting on the eye lens, in case of myopic patients or myopic defect who has, as and when the rays which is going from faraway objects, after hitting on the lens, it converges at a point in the eyeball which is in front of the retina. Here you can see that the rays which are converging at the retina, but here you can find that the rays are going and converging at a point in front of the retina. If the rays are converging at the retina, the person can see the object clearly. But here the rays are going and falling or converging at a spot in front of the retina. As a result of it, the person cannot see the object clearly. So this is the myopic eye we can see. Myopic eye. That means as a result of here the image formation, in case of myopic eye, image formation is taking place in front of the retina. As a result of it, the person cannot see far away object clearly. Now, for correcting this defect, this disease we cannot be able to cure, only we can correct it. For correcting that, we can use a concave lens in the spectacle. If you are using concave lens in the spectacle. After hitting on the concave lens, the ray a bit diverges and falls on the eye lens. After that, it converges on the retina. As a result of it, the person can be, this is, we can say that, corrected eye. Cured eye we are not saying, corrected eye. As a result of it, the person can be able to see the far away object also. Nearby object, of course, they are able to see. By using this concave lens in the spectacle, even they can see the far away object clearly. So, once again, a quick revision of myopia. What is meant by myopia? Myopia means the person who can see the nearby object clearly but cannot see the far away object clearly. Now, why it is happening? Because of converging power of eye lens is more. One thing, reason of, we can say that what are the reasons for myopia? First reason, converging power of the eye lens is high. Converging power of the eye lens is very high. Second thing, eyeball elongates. Second reason is elongation. That means the length of the eyeball becomes more. So, elongation of eyeball. Eyeball elongates. So, there are many reasons may be there, but we will study two reasons. First thing, what is there? Converging power of eye lens is very high. Second thing, eyeball elongates. As a result of it, myopia is occurring. Myopic patients, the converging of the eye lens is occurring in front of the retina, not on the retina. Now, here, for correcting that, we are using concave lens with the appropriate focal length. That means the people, those who are having myopia, hypermetropia, they are using lenses in their spectacles, but all are not having same lenses. So, depending upon their problems, they have to use different powered lenses in their spectacles. Now, here we will study the hypermetropia. This is, we studied about the myopia. Now, these figures I given for hypermetropia. We will study now what is hypermetropia in detail. Now, in case of hypermetropia, normal human eye or normal eye, their faraway objects or the rays which are coming from an object, that will come and fall where? On the retina. So, we can say that the converging power of the eye lens will be normal. As a result of it, image formation will take place on the retina. But if there is any hypermetropia problem will be there, then again we will see the rays of light which is coming from the object, that will be falling or converging beyond the retina. The converging or the lens or the image formation, the rays which are coming and falling on the eye lens, that is converging the rays, but problem is that convergence is occurring properly. At the same time, this eyeball, it flattens. As a result of it, its length reduces. So, as a result of it, image formation is taking place beyond the eyeball. Here, in this case, this is the normal eye, this is the normal eye. But here, the length of the eyeball increases. Here, length of the eyeball increases. here length of the eyeball decreases. Length of the eyeball decreases. This is one problem. So we can say that here which all problems are facing by the eyeball. That is, due to myopia, the length of the eyeball increases. Here length of the eyeball decreases. But that is all minor changes. It won't become so long. Slight changes only occurring in the length of the eyeball. Either its length increase or its length decrease. If the length decreases, then the image formation will be beyond the eyeball. Or we can say as beyond the retina. Beyond the retina. Here, what is happening? In front of the retina. That means image formation is taking place in front of the retina. Now one more thing is there. Here, in case of this lens, this defect, converging power of the lens is very high. We can write one more point, that is converging. In case of myopia, converging power of the lens, converging power of the lens is very high. Large we can say, or very high. At the same time here, in this case, converging power is very less. Here we can say converging power of the lens is very less. So here in this case converging power more, because of that image formed in front of the retina. At the same time here in this case converging power is less, because of that it is when farther from the eyeball and we can say that farther from the retina it formed. So we can say that in this case, in the case of myopic patient, length of the eyeball increases. Second problem, converging power of the eye lens is becoming very high. In the case of hypermetropia, length of the eyeball decreases. Second thing, converging power of the eye lens is very less. Now for correcting this defect, we have to use a convex lens in the spectacle. As a result of it, the rays of light which is passing through this lens, again it will pass through this lens. As a result of it, it can be able to converge at the retina. As a result of it, the person can be able to see the object very clearly. So here we can say that corrective measure of hypermetropia is using convex lens in the spectacle of a person who is suffering from hypermetropia. If hypermetropia is there, far away things that person can see clearly, but nearby things cannot see very clearly. In case of myopia patient, the person can be able to see the nearby object clearly, but a far away object cannot see clearly. So for that, in their spectacle, in case of myopia person, that person should wear concave lens using spectacle. At the same time, the person who is having hypermetropia, that person should use convex lens in their spectacle. Now we are studying one more defect of the eye, that is presbyopia. Now we will study other type of eye defect, that is known as presbyopia. Now what is presbyopia? It is a kind of eye problem or eye defect that is commonly occurring to the people, those who crosses 40 years of their age. Now, why it is occurring such a problem to the people? Because the eye lens, which is unable to focus its focal length. Why it is unable to adjust the focal length? Because of the muscles which are near to the eye lens is getting weaker. As a result of it, the focal length adjusting ability of the eye lens is not functioning properly. Now, the people, those who are having presbyopia, they are unable to see nearby things as well as far away things properly. As a result of it, for correcting that defect, they are wearing spectacle. In that spectacle, two types of lenses are fixed. Upper part having concave lens and down part is having convex lens. This concave lens is helping for seeing far away things, and convex lens is helping for seeing nearby things. As a result of it, we can say that the people, those who are having presbyopia, can be able to see without any difficulties far away as well as nearby things. The lenses too kept in the spectacle, one is concave and the other is convex. So because of that, in general, we say that the lens which is fixed inside the spectacle, that is bifocal lens. So we can say that the people, those who have presbyopia, they are using bifocal lens in their spectacles. Thank you.